Could you also share your views on having your own personal health experience? How has that given you more empathy in the space to understand challenges and issues of other people?
I naturally, like other people, I'm very social, but my experience started when I was 10, and I had to learn very early that I had to start trusting people with my life, basically, because I didn't know what was happening. My parents didn't know what was happening. We had to use professionals and specialists to come up with a range of different techniques to find out what was actually happening to my body. So I started to develop kyphosis, which creates a curvature of the spine that's a bit more evident than the scoliosis. And it wasn't until I met a very amazing young man, a newly qualified orthopaedic surgeon, who picked up on an x-ray of mine. I had actually gone into hospital for something else, and he saw my x-ray and came to visit me, and he said, look, I think we need to do this rather than this. It's your choice. I'm like, gosh, I'm only 10. What a decision. My mum and I are baffled because we had no idea, but he'd obviously come up with the solution of why I was having all these symptoms. So I started to spend a lot of time in hospital, and I saw a lot of things. I was always in an adult ward because of the orthopaedics. They didn't have a specific children's ward at the time. So I was 12 in a ward full of 13 or 14 other adults, hip replacements, a broken back. I do remember meeting a gentleman with a broken back, amputations, and I would, as part of my physio, I started to develop walking skills again after I'd had the surgery. And so I'd go and visit everybody, but get myself out of my own bed. And I was like, well, where am I going to go? I'm in a hospital, can't go up and down stairs yet. So I started to push the tea trolley around, and I'd start giving out the afternoon tea. So I started to see things more frequent than probably someone else my own age that hadn't had that experience. And my mum was also a caregiver as well. So I think from that perspective, she's always created that empathy, care for other people. And then once I left the surgical realm, I suppose, over about 12 years, I thought, oh gosh, I really would like to do something that's very meaningful. And then when I became an early childhood teacher, the reasons behind that were because I felt like if I could expose myself to children at a young age, that would help them understand and accept someone with a disability as they grew up. And it seemed to work most of the time, And then moving from that directly into the disability space, which sort of connected the dots, I guess.